So good morning, sir. So I'm Andrew P. Cuba and I'm from BSN 1B. So I'm going to demonstrate the assessment for the head, neck, hair, skin, and nails. So first, we need to introduce ourselves to the patient. So, good morning, ma'am. I'm Andrew P. Cuba po and I will be your student nurse for today. So ako po yung mag-assess po sa inyo sa head po nyo, sa neck, sa skin, sa nails, and hair nyo po. Ma'am. So can you please state your name, ma'am?
Angela Cuba.
Po. So, when is your birthday po?
June 17 po.
Okay po, ma'am. So, how old are you po? So, next, after that, we need to perform a hand hygiene. Then, provide the patient with the privacy. So, you can provide the patient with the privacy by closing the door and the curtains. So, first, we're going to collect for the subjective data. So, ma'am, I just have some few questions to ask po. I hope po you can cooperate with me. So, ma'am, for the skull and face here, ma'am, do you have any lumps or bumps?
No.
Itching, scaling, or dandruff?
No.
Also, loss of consciousness, dizziness, seizures, headache, ma'am, facial pain or injury po sa head, sa pain. So, length of time, any other problem, system, if may lungs po kayo, wala naman. Any known cause of any other problem system?
No.
Associated symptoms, ma'am, or treatment, So for the hair, ma'am, recent use of hair dyes, mga po kayo ng hair dyes, yung dati,
Minsan.
rinses, or curling or straightening preparations,
Yeah.
recent chemotherapy,
No.
presence of disease.
No.
So for the neck, ma'am, any problems with neck lumps,
No.
neck pain or stiffness,
No.
when and how any lumps occurred, ma'am, any diagnosis of thyroid problems, any treatments such as surgery or radiation.
No.
So for the skin, pain itching, ma'am,
No.
presence and spread of any lesions, bruises, ma'am,
No.
abrasions or pigmented spots, skin problems, ma'am,
Wala naman.
associated clinical signs, use of medications, ma'am,
No.
or lotions or home remedies,
No. Wala naman.
excessively dry or moist feel to the skin,
No.
tendency to bruise easily. So any association of the problem to a reason of the year. So for the nails, ma'am, diabetes mellitus, peripheral circulatory disease, ma'am, previous injury, ma'am, severe illness, ma'am. Ma'am, so we are done with subjective data. So thank you po for cooperating with me. Morning, sir. So now we're going to collect for the objective data. So assuming that so I've already put the gloves on. So first we're going to assess for the skull and face to the patient. So inspect for the size, shape, and symmetry to the patient's skull. Then palpate for the skull of the patient for any lesions, nodules, masses, or depression. So using a gentle rotating motion, using the fingertips, we're going to palpate the patient's skull, beginning from the front to the midline, then to the back, then sa side ng head. So next, we're going to inspect for the facial features. So inspect for the eyes edema and hollowness. Then note any symmetry or facial movements. So ma'am, can you please elevate your eyebrows po? Frown ma'am. Can you please lower your eyebrows? Can you please close your eyes tightly ma'am? Okay ma'am. So can you please puff your cheeks? Okay, so ma'am, can you please smile? Show your teeth ma'am. Smile lang po, ma'am. So next, for the assessment for the hair, so we need to inspect for the waviness over the skull. Then inspect the hair, texture, oiliness and thickness. Okay. So for the assessment of the hair, first we need to inspect for the waviness over the skull. Inspect for the hair texture, oiliness, and thickness. Then note any presence of infection or infestation by parting the hair into several areas. Then sa gitna. Then behind the ears. Then hairline of the neck. Then inspect for the amount of body hair. So for the assessment of the neck, first we're going to assess for the neck muscles. So inspect for the sternocleidomastoid muscles or trapezius. Then ask the client to hold and erect. So ma'am, hold and erect po. Okay ma'am. So, observe for the head movement. So, ma'am, can you please move your chin to the chest, over your chest, ma'am? Then move your head and chin, ma'am, upwards. Ito, ma'am, then move your head, ma'am, towards your shoulder, the right, ma'am. Then to the left. Then, ma'am, can you please move your head to the right, then to the left, ma'am. Okay, ma'am. So for the muscle strength, assess the patient for the muscle strength. So ma'am, can you resist lang po kayo ma'am. So I'm going to put my hands to your head. Resist lang po ma'am. Then sa kabila naman. So ma'am, so can you please ma'am shrug your shoulder? Diba ma'am? Shrug the shoulder of the patient using your hands. So for the lymph nodes, so palpate the entire neck for the enlargement of the lymph nodes. Then the trachea, palpate the trachea for lateral deviation. Then place on fingertips over the trachea. Then onto the supra-sternal notch. Then to the left and right border of the clavicle. Then sa sternocleidomastoid muscles and to the trachea. For the thyroid gland, so we're going to stand in front of the patient. So we're going to observe for the lower left half of the neck of the patient, overlying sa thyroid gland for symmetry and visible masses. Then ask the client to hyperextend your head. So ma'am, can you please hyperextend your head maybe? Swallow ma'am. If necessary, offer the client with a cup of water para mas madali niyang maswallow. Okay, so palpate for the thyroid gland for smoothness. Then note for any enlargement of the thyroid gland for lesions, masses, or nodules. Then, if enlargement of the gland is suspected, we need to auscultate So using the bell and diaphragm of the stethoscope, we need to auscultate. So for the assessment of the skin, we need to inspect for the skin color, inspect for the uniformity of the skin color, then assess edema if present. Then inspect, palpate, and describe skin lesions. So use a glove if lesions are open for draining. Then describe the lesions according to its location, type, size, shape, symmetry, distribution, configuration, and structure. So palpate, observe and palpate for skin moisture. Then palpate for skin temperature. So compare both hands and feet by using the back of our finger. Note any skin turgor by lifting and pinching on an extremity. So for the nails, so inspect for the fingernail page shape to determine its curvature and angle. Inspect for the fingernail and toenail for its texture. Then inspect for the fingernail and toenail to its bed color. Then inspect for the tissue surrounding the nail bed. Then perform the blanch capillary of test refill by pinching or pressing the two or more finger of the patient using our thumb and index. So look for bunching or return in pink color to the nail bed. So next we're going to document all the data that we've gathered. So we are done with the procedure of the head, neck, skin, nails, and skull and face. So we need to document all the data that we've gathered. So that's the procedure on how to assess or the demonstration on assessing the neck, skull and face, head, nails, and skin to the patient. Thank you.